Hello everyone, I'm Dr. Sienna Miller. I'm a naturopathic physician and I specialize in dermatology. Today I'm going to be talking about a very important topic, and that is topical steroid withdrawal. Topical steroid withdrawal occurs when topical steroids are abruptly discontinued after long-term use or after high-potency topical steroids are used. It's a really important topic to talk about because it's a relatively new diagnosis and it is still poorly understood by the medical community as a whole, and some providers are not even aware of it or do not accept it as a real diagnosis. Topical steroids are so readily prescribed and used, especially in dermatology, primarily for conditions such as eczema, other types of dermatitis, and psoriasis. Topical steroid withdrawal, or TSW for short, basically is this rebound reaction that occurs when topical steroids are discontinued after prolonged use or after high-potency steroids are used. What we're seeing is that there's this rebound eruption on the skin, often much worse than when the person first started the steroids. Symptoms include redness, severe itching, burning, skin flaking, peeling, elephant skin, or like really loose looking skin with folds. And then you can even get oozing and weeping, so like fluid can be draining from the skin. Beyond skin symptoms, patients have also reported severe insomnia, depressed mood, and anxiety as well. This is so important to be aware of because it's caused by topical steroid use, and a lot of times patients are going into their doctor or dermatologist and they're being prescribed more steroids or stronger steroids, which is just going to make the problem worse. If you are someone who's been prescribed topical steroids, it's really important to be aware of this and advocate for yourself in a healthcare setting. The only way to fully heal from TSW is to completely discontinue topical steroid use. Of course, if you're already using them, you'll want to gradually taper off of them rather than abruptly discontinue, because that can, again, cause another flare. The only way to truly heal from this is to avoid topical steroid use and allow time for the skin to heal. I also will do nutrient support and usually a multivitamin with my TSW patients. This raises such an issue that the topical treatment for things like eczema and psoriasis and dermatitis are so limited, and topical steroids are such a mainstay of treatment for all of these conditions. And again, this is another reason to seek out alternative options and really dive into identifying and treating the root cause of your skin condition. All right, sometimes topical steroids are necessary, and there are things you can do to avoid TSW. So one is use them sparingly and for the shortest duration as possible. They really should not be used as long-term treatments. Like if you're prescribed a topical steroid and told just continue this forever, that's really not a suitable long-term solution. Using the lowest possible potency to improve your condition is also very helpful, so not going straight to the highest potency unless you need it. And then lastly, if you are on them, making sure to slowly and gradually taper off of them and discontinue. So you never want to just, especially if you're on the high potency, you never just want to take it away. You'll want to slowly reduce to lower potency and less frequent use until you're completely off of them. If you think about oral steroids such as prednisone, it is so crucial every time to slowly taper off of that, because you can go into adrenal crisis, which is a medical emergency, and have very serious health outcomes from that. But again, if you think about steroids, just remember that they should always be tapered down versus abruptly discontinued. All right, I hope that was helpful. I just wanted to get this information out there and start the conversation. If you know anyone who uses topical steroids regularly, make sure to share this video with them because it could be very helpful. Don't forget to like the video if you enjoyed, subscribe to my channel for similar content, and I will see you in my next video. Bye.